wanted me to go to the screening is my mom. She would always talk about it, saying cancer is a very dangerous disease and it can affect anyone.
Cervical cancer is supposed to be a cancer that's related to women, according to the information that I've heard. I was once educated regarding that and encouraged to go for testing or for checkup. But then I never had that interest of really eager to know more about it, because I thought it will never affect me or any person.
This disease, I would say, it's a killer disease, and many times our people find it like in a very, very, very late stage. Sometimes it's when they will notice that they have this problem. So the earlier we sensitize our community about the disease, so it's the earlier also we are able to screen them and put them on treatment.
Cervical cancer is one of the deadliest types of cancer for the death of many women, not only in Namibia, but worldwide. Globally, cervical cancer is said to be the fourth most common form of cancer in women, with around 660,000 cases diagnosed worldwide in 2022, according to the World Health Organization. The disease is rapidly becoming a burden in developing countries. According to Slobodan 2022, on average, about 350 new cervical cancer cases are recorded in Namibia per year, and 203 deaths result from the disease. Libertine Hawanga is the manager of the Cervical Cancer Prevention Program at the Rundu State Hospital, responsible for all the needs and care for cervical cancer patients.
Cervical cancer is a very silent killer, because most of the times women are coming to the facilities and they don't feel the need to be screened because they are not feeling anything. We have also had cases where women are showing up on the last minute because they have never presented to the facilities on time to be screened.
According to the Directorate of Health Statistics in the Kavango East Region, out of the 6 diagnoses, 1 death was recorded in 2024. Human papilloma virus, also known as HPV, is a common sexually transmitted infection that can affect the skin, genital area, and throat. Persistent infection with high-risk HPV can cause abnormal cells to develop, which go on to become cancer. To find out more about what cervical cancer is, the causes, and the type of symptoms, we visited the state and private healthcare facilities in Rundu urban and Rundu rural areas. During our engagement, we spoke to the health experts and community members, including a cervical cancer survivor who shared her story of how she battled cervical cancer.
Cervical cancer is cancer of the cervix. The cervix, in simple words, is like the mouth of the womb. So it's the one that whereby the abnormal cells accumulate on the cervix, which now turns to cervical cancer. Cervical cancer is caused by a virus called HPV, which is human papilloma virus, which we have all been exposed to one way or another at some point, especially if the person is sexually active, they have been exposed to it. So this virus it can move from a male to a female And so as we know that cervical cancer is only in females because it's only females that have a cervix. So once the person is exposed to, then infection is caused. But you can be exposed to HPV, but you may not develop cervical cancer. But also you may be exposed to HPV and then you develop cervical cancer. But to say cervical cancer is not a sexually transmitted disease, but HPV is sexually transmitted in terms of either sexual intercourse or sexual organs, maybe just sexual organs whereby one person is infected and it's transferred to the next person. Cervical cancer mostly don't really have symptoms from the beginning. You may not feel it, especially when you have precancerous lesions. The cervical cancer is in different stages. There's a stage that we call precancerous lesions, whereby lesions are on the cervix in a precancerous stage. It's not really yet cancer, but there are lesions on the cervix. So once the person starts experiencing symptoms, most of the time it's a cancerous stage. Symptoms such as vaginal bleeding, vaginal discharge, a pain when having sexual intercourse, pelvic pain. Some of those are the small symptoms that the person can have when they have cervical cancer. But most of the time, these symptoms are missed for other issues like low abdominal pain. One would think of maybe the person is pregnant, or maybe the person is just having a general STI like vaginal discharge. You would think of a general STI and so on. So most of the time, these symptoms are missed. That's why it's very important to be screened for cervical cancer, for precancerous lesions before, because you mostly miss some of these symptoms. In the early stages, the precancerous lesion stage is treatable. And we would always say cervical cancer is a preventable cancer in terms of screening, because if the person is screened and precancerous lesions are found on the cervix, we can treat the person. For example, once the person is screened, let me say by a nurse, and they find lesions which are small and they are not inside the cervix, like the hole, we call it the os. There are maybe just small regions around the os. It's called thermocoagulation, so it can be treated. And if the lesions have spread throughout the cervix, maybe they are big and so on, can be treated with what we call LETs by doctors, where they take the person in theater and just cut out those lesions. And if it's in the stages of cancer, that's when now maybe blood need to be collected or send the person for biopsy and so on. Most of the time, once it's in the late stages of cancer, it's a sad reality whereby there's not really treatment. It's just more of chemotherapy. They do all those kind of things. So that's why we encourage, once it's in the precancerous lesions, it can be removed, simple, treated either at a health facility, at a clinic, or local district hospitals where it's treated.
Susan Siyunda from Mashare village is one of the survivors of cervical cancer, diagnosed at the tender age of 22 after she tested positive for the disease in 2023.
I just decided on my own that I want to find out if I have cancer. So I went there. I actually went there because I was ill. I was sick that day. Then I went to the clinic, Mashar clinic. Then I went there. I was treated for my illness. After that, I just decided to ask the nurse if there are any doctors or nurses that come out to reach out if they do the cervical screening for cancer. And she told me yes, they do it. Then she wrote my name in a book and gave me a follow-up. And I went there. After going there, the nurse came. Then she told me I should go in a room. We went there. Then she inserted the, I don't know how it's called, into the vagina. After that, she put in the vinegar. I laid down. And she told me I would see if they would find any white things inside. It means I have it. If not, then I don't have it. I was also having symptoms like I would have severe pain in the womb. Sometimes I would bend like I couldn't walk. I would always be sleeping. So that also made me go there.
region consists of 6 constituencies sharing 3 main hospitals, namely Andara, Nyangana, and Rundu State Hospital. Situated in the northeastern part of Namibia, the region formerly known as Kavango was in 2023 split into 2 regions, now known as Kavango East and West. The boundary of these 2 regions emanated from a political pronouncement by His Excellency Dr. Hifikepunye Pohamba during his tenure from March 2005 to the 21st of March 2015 due to the region's vast geographical political landscape.
I have accepted the Commission's recommendation that the Kavango region be split into 2 regions, namely Kavango East region and the Kavango West region. This brings the total number of regions in Namibia to 14.
We began our journey in the far eastern part of the region in the Mukwe constituency in a small village known as Omega. Omega is situated along the Trans-Zambezi Highway. The Kwe marginalized community lives in Omega, close to the Bwabwata National Park. They are considered to be one of the oldest surviving cultures in the world. Although the Kwe San were previously classified as disadvantaged, there is noticeable progress and elevated interest in education and awareness within the community.
We are here at Omega community where we discuss with women regarding cervical cancer and also asking them on their knowledge on cervical cancer. And amongst the women that we discussed with is only one that indicated that they know about cervical cancer and they've been screened before. So we have educated the women on the advantage of being screened with cervical cancer and being screened early and to be treated early. Amongst them there was a bit of hesitancy on screening, indicated also a bit of gap knowledge. They are really not well aware of cervical cancer.
The village has a clinic equipped with a health worker responsible for cervical cancer screening. Roide Thindano.
We are currently at Omega Clinic in the Kavango East Region. We are now going to talk to Sister Roide Thindano about the cervical cancer screening service that is offered at the clinic.
Per month, I usually used to see 15 to 20, both the HIV negative and the HIV positive patients that I used to screen.
Okay. Can you take us through the different methods of the screening process?
The first one is pap smear, where we're supposed to take a brush and get the fluids around the cervix, and also then we send the specimen to the lab. We wait for the result. And the other method is a via. Via, you get your result immediately after 1 minute. So that one you just check there.
Do you think the community members here are well informed about cervical cancer? And what do you think can be done to further raise awareness on cervical cancer within the community?
For the community, they are not full aware, but I can say it's half of them, because we can find in a week someone is just coming for that cervical screening. She will come and say that, no, I came to be checked for cervical screening, not only for treatment, but some you get them through postnatal, and also we also screen for those ones who are HIV positive. When they come for follow-up, when you check in the file, they are not screened, we have to screen. But then you find some are just coming for those. So it means that they are aware that they were doing cervical screening at our clinic. Like for those who are HIV negative, the age you have to start from 25 years up. Then they have to come for via screening. And if you are HIV positive, your age have to start from 20 years up to be checked for that. So it's important to check yourself every after 3 years for HIV positive and 5 years for HIV negative people.
Next on our journey, we traveled to Andara, Ndiona, Ndongalinena, Mashare, Rundu Urban and Rundu Rural constituencies to assess the knowledge gap and whether women do go for regular screening.
Nawa dina liende Cecilia Mlonga parua na kuministri yo ukangu Kavango yo ukume yuko na hiyo vikisha wena tokuna kutapa ngoli mashongo kama na tanke yo mkoa wale papa tunakara wale bayuvo kukangiri yo mkoa wale ari yuvo rumwe ndiko shosi ndimu dimukunda apita yuvo rumwe
Nyaura wantu ndikuna kuivera
na kuitwa nyaura wantu twayuva ari ambo shivinge mwayuva nani ashivinge mwayuva ko wale mudame kengoli mwambe shivinge mwayuva ko
ifangara huku mumukoa pamwe apa kuyowana mura kukwatera kuingira tumburu kwalika mundu kamwe ngolitu anike pano wale bankara namukafumu ura uiwera nchuchu mkoa woye mara kwatu inakushoro
nakuya unene kubaka mali nepo ndio vanakaro pada mtondo kora ndi kuvura kuwana kutesta kumkoa kene vanali kuwana ineshina kansa yoye kura kuvatera wangu wake bishidi kene shironda kudidi kene shakura kutuma kuninko ngolo kutuma ngoli kuvinduka okuma yuva yo mpudi ne kuninko kovayanga vaka mkoa kovayanga vatunde kurundu nakora mpo vaire mpo vampire ngoli yo mpudi auno na umweni ngoli vamkengara umwe ndipi vayamkengire momno mnovemba mwaendere kuvakamkenga kakala tukengere kwa kunyagana
okay
Januari na vakamalirana kwa kinga mkoa
okay vakamalirana nakuvakenga shimukoa konda moramo mukoa we mushi mwana kara muntu
Any family member that experienced it?
Wakarako na likoro leo umwe wakaro no udito overao.
Ndiko byo avali hempo
Bakara babiri. Kuni banakara?
Kwimbo.
Kumndi banakara? Yeah. So she's having two of the family members having the same disease at home.
During the investigation, health workers from various healthcare facilities shared the challenges they face daily.
Okay, what are some of the challenges that you have experienced with regards to getting women to come for the cervical cancer screening, and also in cases where they are found with the precancerous lesions, getting them to come back for treatment? What are some of the challenges that you have experienced?
We have a lot of challenges that we are facing. For example, patient factor. If you book a client, for example, to come for even for routine visit, some clients they don't turn up, and also when it comes to cervical cancer screening by male nurses, is the challenge that I'm facing. You can say the client is eligible, but the client opted to say no, I don't want the VIA to be done by me. So in that case, we have to call either the doctor who has been trained with the main site. If that doctor who is trained is not around, that client, we have to book the client to have a schedule. Then we find out that client might not come again. And also we have some clients, especially in the district, you find out they are booked for their visits, for review, but they are booked to be seen at the hospital. You find some challenges of the distance to come from where they are staying to the hospital. You find out they will be missing their visit.
Another challenge observed in the community is that most women have cultural beliefs that going for screening causes infertility and an irregular menstruation cycle, among other myths.
The main challenge is for the people to come to do the screening in the first place. Because I'm not sure, in the community I think there are a lot of myths around coming to do the procedure. Some say that, the way we do these procedures, sometimes the womb is removed, sometimes they will have challenges with having babies, what we call infertility. But these are just myths that are in the community. Our procedures are very, very safe, and they are cost effective, and actually they save lives.
When the female nurse coming in as an outreach nurse from Rundu, you find the number increase than as I'm doing.
Normally we get there some women who come with persistent PV bleeding, and then there are some who normally have low abdominal pain, like the whole passport, almost the whole passport they have low abdominal pain, and they have some discharges, increasing the vaginal discharges. So those are the ones that we refer to the doctor, because sometimes we may tell them that it's a vaginal disease symptoms, but then it's like it's oncoming, like recurrent infection all the time. So we advise and refer them for cervical cancer screening.
While engaging the community, it became clear that some women are misinformed about cervical cancer. A lack of understanding of the disease and its prevention has led to women opting not to go get tested.
Cultural factors. We still have a few number of women who believe that cervical cancer screening is not a must, and there are so many misconceptions, like for example, if you get screened, you'll not be able to bear kids, you'll not be able to be intimate with your partners, and we really have to work around these things to dispel all these myths.
Mostly, even with the new technology we have currently, most of the community members, they are not aware of cervical cancer. As for myself, I just heard about it because I watch through TV or I read through social media. Regardless of other people that don't have those, I don't think they are aware of that. So it's good for the government to come up with such programs to educate the community members, and come up with such programs for even at the clinics to have a program whereby they just educate people just the way they do with TB, malaria, and all other programs that are known.
I think first of all, what can be done is like as staffs here who are like direct communication and direct contact with the patients or clients, I would say. I think we are the first people that we need to be aware first. We need to be trained or just to have an idea about everything about the cervical cancer thing, so that we are able also to communicate it very well with the community. But if we lack the knowledge, us who are providing the health services here, so to be hard. So unless the staffs need to be trained first for us to communicate the information well to the community.
Even though women in the urban area know what cervical cancer is, compared to their rural counterparts, both groups are not proactive when it comes to getting screened.
waba gwanekere nawo makora mo kuitiga nyuma igendi tani tivi so sinke na ikuliki kisasi amengesi ntuti iwe ya karaka tunaitiga
kwa wizire ku kliniki tati yalichangiza twakere bakuru kadivasiki murongo na bane iyo twarondere metu watatu twara ku kliniki za Kaisosi ukuzigida gumwe na gumwe mokanzugo makurata test time elimburo kapirakara ure onobili poko tukuwa kutara ngoso nelimburo lyogeto ligwana asio kara no vera ngika pyo kara no vera.
To find out why most women fear the screening process and have an objective result, the team visited public and private hospitals to study how the process is done and also to see the types of medical equipment used when screening.
We are currently at Nyangana District Hospital, where they also offer cervical cancer services. Let's find out more.
I'm okay. Have a seat.
Thank you.
This is the bed that we are using for our clients when we are screening them for cervical cancer. As you can see here, there is also a private maintained when we are doing. We close our doors. This is the lamp that we are also using for lighting as well. And this bed also is very comfortable for our clients. We can even tilt it when there is need, but as it is, it's more comfortable. The stirrups are already there, and I can say it's more comfortable to our clients. Yes.
Laimi Kazibe is the cervical cancer prevention program nurse at the Rundu State Hospital. Kazibe explained that before the screening process starts, she first records the patient's health background and also educates the patient about the cervical cancer screening process.
So this is our screening room. We'll do the screening.
While speaking to Kazibe, a 30-year-old woman entered the premises requesting to be screened.
Come in. Hello, afternoon. How are you, ma'am?
Fine, thanks. How are you?
Fine, thank you. How can we help you today?
I came for screening.
Cervical cancer screening?
Yeah.
Okay. Have you had a screening before done?
No.
It's your first time?
Yeah.
Okay. So we are going to fill out the form first, just to obtain all your history before we do the screening. So tell me, what do you know about cervical cancer screening?
Oh, nothing much really.
Okay.
I know it's deadly.
Mm-hmm.
That's basically it.
Okay. So what we are doing right now, we are having two forms of screening, ne? Two methods of screening. Usually the younger women will screen with what we call VIA. Ne? VIA. So we take medication, we put on the cervix, and then after 1 minute we remove that medication, put on a light to check how is the cervix, if there's any infection that causes cancer. Are we together? So once the infection is present, then we have to treat it, okay? So if there's no infection present, that means that you are good for now, and then you have to be rescreened depending now on our HIV status, okay? So when was your last HIV test done?
Last month.
Last month. Okay, let me just cross-check that for you. Okay, perfect. It's here. So now I'm just going to fill out this form now. Your full names?
Esther Kemba.
Esther Kemba. Okay, where do you stay?
Kemba.
Cell phone number?
081 30
30
11187.
11187. Okay. So you said you have never had a pap smear or a VIA done before, right? Okay. Okay, so I need you to sign the consent for me. This just says that we have spoken about this and you understand what we are doing, okay? All right, thank you so much. We can go inside now. Bathroom, please just change everything out and then you use that linen to cover yourself. You come back out here, okay? Thank you. So, as I was saying, we are doing VIA now. So, with VIA, the cervix looks like this. Okay, do you see these pictures? All this is the cervix. Ne? So, a normal cervix looks like this. So, when we are doing VIA, we are putting medicine here for 1 minute. After 1 minute, then we remove the medicine, switch on the light to check for any changes on the cervix. So if there is no changes, it remains like this. Already your result is VIA negative. Okay, so if there are changes, what we are talking about changes, we mean the infection that causes cancer. If it is present, it tends to become whitish like this. All right, now this means that the virus has started. You don't have cancer, but the infection that causes cancer is present and it has started causing changes on the cervix. Okay, so once we see this, we need to treat it. Otherwise, if we don't treat it, it will continue to grow until it becomes cancerous. Are we together? So there are two forms of how we treat them. The ones that are a bit small, we usually freeze them to avoid them from growing, and then you'll have a yearly follow-up. The ones that have covered a large amount of the cervix, we refer to the doctor. So the doctor comes here every Friday, and then she comes and peels this off. Okay, so once we have peeled it off, then we send it to the lab so that it can be tested just to assess how far has it changed itself. Okay, sometimes once we have entered into the vaginal canal and we check, it already starts to look suspicious. What we mean by suspicious is that we can see that there is a present change on the cervix already, which could be cancer. We're not saying it's cancer, it could be cancer, but we still have to test anyways just to make sure that it's cancer. Are we together? Any questions for now? Understood. We're good, okay? All right. Okay. Just adjusting the bed quickly. Okay. Just trying to locate it with my fingers now. Okay. So with pap smear, it's the same procedure, only that we are not putting the medicine and we are not using the light. With pap smear, we are collecting a sample from the cervix, which we send and is tested at the lab under a microscope. That's the only difference. So that one takes a little while for the results to come out, and we are only doing it to the women who are above 50 years old. Yeah. Now I'm just waiting for the results to read, okay?
Apart from the VIA screening process, Dr. Lugano Dovi, an obstetrician and gynecologist, specialist in women health at the Rundo Private Hospital, explained how the pap smear process is done in his views on the disease.
So being in the private sector, just share your experience of dealing with cervical cancer patients with us.
Right. So basically my experience has been that from the screening process, most of our clients will come in voluntarily to ask for a pap smear, and those are the ones that are probably aware of the importance of cervical cancer screening. And most of the times they'll turn up for their routine test probably once every year. And then we've got other clients, which is a form of like an opportunistic setup where they come in with a particular problem, and through that then we do a test for cervical cancer screening. And most of the times these will be women who have just delivered 6 months post-delivery. Then we normally would ask them to come in for cervical cancer screening as part of their routine test that we do after the delivery, or if they've got other problems, abnormal uterine bleeding and stuff like that, then we would also offer them a chance to have cervical cancer screening. And most of the times what we do in the private sector is that we do pap smears, but there are other forms of screening that can be done, which we know, which is visual inspection using acetic acid, and that's also available for other clients. So those will probably be two forms of our experiences, and we tend to see that most of our clients would come in to ask specifically for cervical cancer screening.
Okay. So on average per month, how many women would you say come in for screening or treatment?
Yeah. So most of the times in terms of screening, it will be 1 in 10 women will probably come in for cervical cancer, and those will be probably voluntarily asking. But in terms of those that are opportunistic kind of screening test, then probably it will go up to 3 in 10 women that will be screened. In terms of treatment, it varies depending on the abnormalities that we tend to see. But on average, I think we'll probably treat abnormal pap smears like 1 in 3 patients, 1 to 3 patients in a month that would have abnormal pap smears that would have to be treated.
Okay. So with everything else, there are some challenges that can be experienced. What would you say are some of the challenges that you have experienced with regard to getting women to maybe come for screening, and also maybe if the results were positive, for them to follow treatment thereafter?
Sure. I think the major challenge has been just general awareness and health education in the community, that people need to be aware of the importance of cervical cancer screening, how we do it, and when is it supposed to be done. Because if the community is actually aware of when they're supposed to go for a pap smear, in terms of at what age, and number 1, number 2, if there are any problems, where can they access those services? Like I mentioned, for us, most of the times in the private sector, we do what we call pap smear, and that restricts maybe for patients who can afford, because it's something attached. Cost is attached to it, so probably that restricts to those that are financially capable to access that. But we know there is a free service for cervical cancer screening.
The results from the investigation revealed that women aged between 20 to 49 were often vulnerable to this disease.
We still have a lot of young women who are presenting with pre-cancerous lesion, and the only way for them to know whether they have this pre-cancerous lesion or cancer is for them to come to the facilities, get screened and detected on time. We are saying that cervical cancer is preventable with early diagnosis. So if you are diagnosed on time, the problems can be picked up and treatment is also available.
In efforts to understand and debunk false information based off tradition and cultural beliefs, former nurse and leader of the Vashambu Traditional Authority, Hompa Sophia Munjembwe, during a visit at her palace, had this to say.
Kansa y'omukowa, kutuyansi kansa y'omukowa yo. Bantu wakara unirisi kapiva yiva kapito yiva nawa basivingi na kuko. Makura bamwe ukara tangu kumandi mbayiwa na kapito unene ngosi wale vakambadhare ko ape mura mpo yetu yosowa gani asitango wale kukambadhara kusowa gani kura paina katika ngori kusipatira katika ngori kubandokotora bamkona kona likona kundufana ngwede goro vanakaviitamu awe seri vanakavimuwana makura mpuyi muwana ngori kwendi kwavitambura ngano udito makura pakona ngori kukara tango kanseri makona tango kukara tango mapuko ruru mungongesi atambure kona wamuvera.
To find out about the role and efforts made by the government, we engaged the Director of Health and Social Services in the Kavango East Region, Ida Mendai, who talked about the government strategic plans which aim to alleviate cervical cancer.
Cervical cancer screening is one of our programs which we are rendering to our patients. Previously, it's falling under PHC, primary health care. But now with the trend of HIV and the disease burden on HIV and the effect it have in people living with HIV, we have now really focused much on it to ensure that all our people living with HIV, women, we really screen them earlier so that we identify the sickness earlier and then put them on treatment and take care of them. So we have really cascaded that. Yes, we are aware of our limited resources to train everyone in our health facilities. Currently now, the way the program is designed, we have started with few facilities where we are rendering these services, and we have trained not every health worker but some targeted health worker due to limited funding and so on, where these services are rendered. We are doing also campaigns just to get them the most of the women screened.
Are there perhaps challenges so far in regard to cervical cancer within this ministry, and how will you address them?
Thank you so much. I think challenges are there, like we mentioned, the issue of training. We still have work to do to ensure that all our health workers are trained and they offer these services. The issue of limited resources to render these trainings is a very technical training which the region need to embark upon. With resources, if we can centralize this training to the regions to ensure that we train more nurses. Because now we find that either regions are clustered to be trained and then you only send maybe few nurses instead of the number which you wish to send. But we'll engage our stakeholders. The ministry have a plan to ensure that we put a schedule through our radios and use our stakeholders. We have a lot of stakeholders in the region which we want to integrate this program within, so that we talk about it and we raise awareness to women. It's not only cervical cancer screening, even our PrEP uptake is also linked to this. Is low. We still experience low uptake. So we are sensitizing through our health facilities, through our stakeholders, people like, stakeholders like NBC, MICT, and all these who are more visible in the community and so on, to ensure that we disseminate this message to raise awareness, to ensure that women come for these services. We don't want to see women coming very late. To treat or to manage these cases becomes very challenging. So we want even to bring messages of preventative, more preventative than curative, because if you prevent a disease, you prevent more hospital burdens in terms of admissions and so on.
In conclusion, every 2 days a woman dies from cervical cancer in Namibia. Thus, a need to fast-track awareness campaigns and education across the country.
I would love to urge all women from the age of 20 years to ensure that they have a valid cervical cancer screening test. It's really important. Even if you are not presenting with any signs and symptoms, just come to the hospital and get screened.
I would just like to encourage young people not to be scared. They should just go and ask. Sometimes you being afraid and you not knowing anything about it can cause you to die, or without you knowing that you have something inside you. So they should always go for checkups. Anything at all, they should ask. And they will get help, because the clinic is there. You can ask. If you don't ask, you won't know anything.
experience for me, I would say it was very good because it's an easy and simple thing. It's not as scary as people made it out to be. It doesn't hurt, and yeah, it's just fast. It's also fast. So I would encourage other young ladies to come and get their screenings as well.
Vyavepo ngoline tuyende vakatukenge kwati vetukala na woma ndina uchirwe kuyenda vakakukenge mukova weshi uwe panke una hamene unakuvera mukova ndi uwa wandi yave ndimbyo vura kuruwana
mukatandira nguli varangwe koko kuvatandira sinene vana mono vimwe vyashoroka ngokwetu tovakulu kati yokumora koiliyona kumona vina kutumbo wali kumeho makura niki kufana nguli kokwangu litanguli kuitwala kusipate kapisimbuleke walisi vakambadare kuwali mbu vaivera tampaso vakansetu iniki kufana nguli sena vaimono kokui kwangu litakondo wangu wakatike kusipangiro wakawane mbatara yokuwanda kutoka.
Early screening is very important, so please visit your nearest healthcare facility to get screened for cervical cancer. Thank you for watching.